Hello, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress 2015 here in Washington, D.C. We're winding down our day 2 of the event, and I'm so pleased to have with me now Dr. Jonathan Woodson, who is Assistant Secretary of Defense for Health Affairs. Thank you so much for your time, Dr. Woodson.
Well, thanks for having me here.
Well, it's really a pleasure to be able to speak with you. I just wanted to find out from you if some of the challenges that we face in the American healthcare system are similar to what American servicemen face in a very specific population of health that you're trying to address.
Well, in some sense, the issues of the American health system, American health care, are the same challenges that we'll have in the military health system. Just a bit about the military health system. So we run hospitals and clinics. We have some 55 hospitals and some 600 clinics, not only in the continental United States, but worldwide. So wherever service members are, we have to provide health care. And a lot of that is the routine health care that everyone else would need, primary care physicians, but also specialty care. So in that sense, we're very much like the American health system. But of course, we also deliver health care and health service support in war zones, and we respond to humanitarian crises, and our men and women are deployed to austere environments around the world. So we have to deliver health care in those environments as well.
How do you stand up and meet those challenges?
So one of the core competencies of the military health system is to be modular, agile, and mobile. Which means that we can take health services support anywhere in the world that it's needed to support troops by bringing personnel, medical providers, professionals, bringing equipment, bringing modular hospitals that can be established. And so that is one of our core competencies, to have the ability to project medical force and medical capability anywhere in the world.
Although you are facing some of the similar challenges, to what American healthcare is facing, you are your own specific population. So what are some of the more unique things that you have to face, and how do you address those?
Well, let me start with some of the obvious ones. So our job is to be key enablers for other men and women to defend this nation. In so doing, after 13 plus years of war, we obviously have suffered a number of casualties. And as I was mentioning during the session in the main auditorium, that there's some good news that despite the more severely injured service member, we can track what we call injury severity scores. The case fatality rate, the numbers that are dying of their wounds, has diminished. So we're saving more individuals that otherwise might not have been saved in previous generations and wars. So that's the good news. But the challenge with that is that we have to bring them back. We have to restore their capabilities. We have to try and make them whole. And as I was mentioning before, our mission is not only to make them physically whole as much as possible, but heal their mind, body, and spirit. So we've developed certain initiatives that I think are very important and now are trying to be actually emulated in the civilian sector. We have this program called the Military Adaptive Sports Program. And so we take what are these incredibly resilient but severely injured service members who may have bilateral amputations or sometimes even 3 limb amputations plus traumatic brain injury, and they're involved in a comprehensive rehabilitation program which is focused on their goals. Much of it is around sports, so we teach them how to surf, how to scuba dive, how to ski, how to do those things that are important to them. Remember, they came in as volunteers with the idea that they were going to be professional service members, soldiers, sailors, airmen, and Marines for life. And when they get injured, it's about getting them back to a status in life where they understand their maximum potential. So it's about not understanding their disabilities, but it's about us understanding their abilities. And this kind of program has just been amazing in terms of creating hope and motivation, so that they really take on life rather than retreat from life.
It sounds incredibly inspiring. Is the military sector good at coordinating care of a single individual?
So I think we are getting better and better at that every day. Admittedly, I think we were behind the curve early in the war, mainly because we were taking the civilian conventional approach to the issue of medical care. The other thing I think we had to come to grips with is a change in paradigm in terms of the historical context. So if you look back to World War II, when we had 16 million folks under arms and we demobilized them, and most of them were conscripts or draftees, it was expected that if they got ill or injured, they were going to transition to the Veterans Administration and be cared for. They were going to transition out of the service. Fast forward to the 21st century, where we have an all-volunteer force, and folks come in expecting again to be soldiers, sailors, airmen, and Marines for life. Their identity is with the service. And so the change in paradigm is about maximally rehabilitating them to see if they can be retained in the service. So we have amputees that now stay on active duty. 24% of amputees stay on active duty. We have individuals with PTSD and traumatic brain injury that are rehabilitated and can stay on active duty. And so there's been a radical change in thinking. And that's why, again, these programs like the Military Adaptive Sports Program has changed our thinking from what is this person's disability to what is this person's ability and potential, and achieving that potential.
Well, is your IT support keeping up with your desire to support these people as much as you can, with the medical health records and sort of the other technological support you need to keep track of people?
So it's interesting that, you know, the military health system was one of the earliest systems to develop its own electronic health record. Now, truth be known, of course, that particularly in the IT world, things get obsolete pretty quickly, and it's clear that our core competency in terms of electronic health records is not what we do. But we have had for a long time a worldwide connected electronic health record that probably was better than just about every civilian sector had. But what we're learning is that we need to improve that even beyond its current capabilities, so that we have what we call interoperability. Right now, because we're charged with providing care not only to active duty service members but their families and retirees, a lot of the care we deliver is actually, or buy, is in the civilian sector, and so we need to connect with the civilian sector. We've launched an initiative to create interoperable health records, and we've partnered with the Veterans Administration and with the Office of the National Coordinator to create standards around how you transmit data. So the analogy I make all the time is that if I were to ask an audience to hold up their cell phone, we would find a variety of cell phones. Some would have the Galaxy, some would have the BlackBerry, some would have the iPhone, and then you name all the other varieties. But everybody could call each other, text each other, send each other documents, and they could compute those documents because there are data standards. Up until now, there haven't been data standards for electronic health records that allow transmissibility of data and for it to be computed. We've done a lot to solving that issue. And that's going to be not only good for us, but it's going to be good for the civilian community as well.
Absolutely. That's a great last word. Well, thank you so much for your time today, Dr. Woodson.
My pleasure being here.
I really appreciate your time.
Good talking to you.
And I'm Mabel Jong. Thanks for watching.